All right. My name's Liz Kuo. I am the Chief Medical Officer of Everly Health. I'm a physician by training, but I went through business school, School of Public Health, have multiple interests in technology as it intersects with medicine and healthcare. I just came in from Boston, so boy, are my arms tired. No, flew in. I will also say that I am really excited to be here today. Just wanted to go through an overview for everyone that's interested in healthcare for AI. So just wanted to go through, for me, a quick background story. The reason why I got into it in the first place is that for a long time, I've always thought, for medicine, you can augment everything that we're doing, from a provider's time to the medical records, with AI, with technology. But I think we haven't really done it in a way that can really accelerate the way we're looking at it. I myself, unfortunately, for my first pregnancy, I lost the baby at 9 months. So I'll go through some of those difficult times, but at the same time, I want to talk about how I would have thought technology would have helped me. So I'll go through some of these ways that technology can not only support the way women carry their babies, giving them information about what stage, what things they should be looking out for, like movement, and all of that. So I'll start by saying social determinants of health. I'm educated, I'm lucky as a physician, but 68% of consumers have at least one social determinant of health issue. That could be lack of healthcare education, lack of resources, lack of even transportation getting to and back from the hospital. So a lot of those things that we're thinking AI can support is by doing virtual care. People have known during the pandemic, there's been a lot of delayed healthcare. What does that mean? Lack of colonoscopies, mammograms, cancer screens. And we've seen the CDC's reporting our inability to try to get people back into the hospital system the same way. So I've been really interested in Everly Health because it's a home diagnostic company. This whole conversation, though, is not about Everly Health. It's about how we can think about AI and in healthcare. So the way I think about it, though, especially is with SDOH, stresses are nearly 50% or more likely to cause people to, with SDOH, suffer from additional chronic diseases. Over 2.3% times more likely to rate their health as fair or poor. So what does that mean? That ultimately means that a lot of people that do not have access to resources and whatnot just perpetuate the cycle. So how do we think about AI to support this? I believe in the quadruple aim. So enhancing the patient experience, improving population health, reducing costs, and improving the work life of clinicians. So I'll talk a bit about this. So enhancing the patient experience. What can we do? So many things. When I was pregnant, could I have been told that, hey, you're not feeling movement. You may want to just drink some orange juice. There are so many apps right now with fertility that they're tracking. You can input your own symptoms and you can figure out if someone is really, high risk or not. There's ways that you can comb through medical records using NLP. A lot of this I'll talk about too, which is how do you look at medical records, unstructured and structured data, to pull that in and give the clinician the insight that this baby is not moving very well. You may want to get her to the hospital sooner and faster. I end up losing the baby, unfortunately, but I look back and I have 3 wonderful children, and I think to myself, could technology have enhanced my ability to track what was happening? I'm a physician, for God's sake, and how did I miss my own diagnosis? So one way that I think patient experiences can improve is, of course, virtual health. There's a lot of really interesting exploration right now with virtual health and recognizing faces. A lot of physicians can't necessarily diagnose something called congenital diseases, which is genetic diseases that if you combine like a little bit of blue hint in your eyes with some facial features, you can actually diagnose early congenital heart disease or other things that are associated with symptoms. And so I believe that AI can actually combine these medical records, symptoms that parents are explaining, things that people are feeling, and then ultimately come to a diagnosis faster and better. I also think improving population health. So I come from Anthem, my prior job, where I worked, which is now called Elevance. We looked at 45 million members for covering them for prior authorization. So if someone wanted an MRI or a knee surgery, you had to go through multiple steps. A physician would have to fax something, and I know even in healthcare these days, I can't believe we're still faxing, but yes, would have to fax, fill out a form and say, this patient requires an MRI because they have had 5 weeks of physical therapy, it hasn't worked, it hasn't improved, they sprained their knee, it makes sense for them to get an MRI. Sometimes that gets delayed for months. So what we could do is comb through medical records, get all of that information, and send it to the payer. So at Anthem, that's what we did with AI. We were able to basically look at what a physician could do, what a nurse would do to triage all this, streamline the medical record keeping system, and then it would flag all the medical records that said, this page on page 6 said that the patient had 5 weeks of medical pain that would qualify for this MRI, in addition to getting an x-ray that didn't show anything, in addition to several other things. So it's guidelines. So population health, improving the way that we look at mammograms and colonoscopies, something that, of course, with AI, with imaging, is starting to become a huge thing. We've seen a lot of people being able to detect breast cancer much earlier on, things that physicians wouldn't be able to see year on year on year, but an AI system could see changes over time. And then reducing costs, of course. There's a lot of drug development now. What we've seen is, for example, the same technology that's being applied to convolutional neural networks, which allows people to track motion, like driverless cars, is being applied to how we're looking at protein binding. So drug discovery, being able to help people understand all these drugs that are targeting this type of protein could be used, and combing through all of that to try to figure out. So earlier drug discovery, faster drug discovery, and of course also improving the work life of clinicians. I myself definitely work in the telehealth space. Everly has 50 state licensed doctors, so we can practice medicine across all 50 states. But what's interesting is there's a lot more work now with physicians having to fill out paperwork. And so we're actually seeing AI companies sit within the physician room. And once they are there, they actually go through the medical records and listen in and try to tease out what the doctor's saying, what the patient was saying, and then ultimately create the notes. Just like Dragon and all these other ways of putting down notes, physicians can then look at the summary and then just click yes, 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 this is exactly what was spoken about, so that they're not going back and dictating and writing these notes down. So improving life of clinicians, another thing is also AI in surgery. We're seeing that especially in preoperative, postoperative, and during the surgery. Full disclosure, I'm on the board of a company called Asensus Surgical, and they work with different surgeons to try to improve its performance guided. So it's not replacing the surgeon, but it's augmenting their ability. So using 3D imaging, they can figure out in real time what the contours of when they're in the surgery room of a certain tissue, and they can measure, and then ultimately allow for them to figure out what mesh size they want to put into the patient. So some of the benefits of AI in healthcare we talked about, but just wanted to focus on 3 key areas as we talked about before. With a lot of people think technology can solve everything within healthcare, but I definitely think you have to think about it from the value proposition and then the stakeholder. Who are the stakeholders? So patients, they have to trust it, they have to believe in it, they have to, sometimes patients also don't know that there is AI in it, but they have to believe that either the AI chatbot or the other things are working in their favor, that they're gonna have secure data, that it's also proven to try to drive them to better outcomes. Whether it was the pregnancy that we were talking about, those apps, or others. Then there's clinician-oriented AI. These are where you have to get clinician buy-in. So much of, I advise a lot of startups, and when they say they're trying to drive AI to get a clinician to change their behavior, it is very difficult. Clinicians are hard to change behaviors. They're used to their own way of thinking, they're used to their own way of moving and procedures. So how do you get clinicians to be excited about the AI is key, and then also for them to buy into it. There's a lot of also interesting digital therapeutics now, so it's these apps that are replacing a pharmacy drug. For example, in opioid abuse or others, there's Paratherapeutics is building out a lot of these. So how do you get clinicians to buy into it, to believe in it, and to ultimately prescribe it is gonna be key. And then administrative, we talked about prior authorization. So there's a lot of that side of AI, but there's also this really interesting space of voice-activated NLP work where you're looking at, say, a really interesting Dutch company is looking at when people call in for 911, there is a voice in the background that's a person speaking, but there's also outside noise, surrounding noise. So the AI algorithm looks at it and combs through it and says, this is person, this is not a person, this is likely to be a cardiac arrest or not. And what they do is they notify the ER, the emergency room, early on if they believe this is a cardiac arrest, so a heart attack. And when they do that, the ER is better at preparing. Sure. Sorry about that. No, not at all. So I have seen a lot of this work happening, and I'm very excited. I think the next step then is how do we get people to understand it? So some of these things in action I'll just talk a bit about. So we talked about, I sort of have a passion for pregnancy care, but this is just an example that I think will be useful for us. This is an app that allows moms to track and share her pregnancy journey, right, with family and professionals. What's interesting is that the algorithm sends out information to the right clinician. There's a clinician workforce and a dashboard, but it also has the ability for patients to be able to track and input symptoms in real time. Pregnancy is pretty important. There's some things that are really important in healthcare in real time, others are not. Chronic care you sort of manage, but if you're trying to reduce cost, so where I come from, Anthem, we want to be able to reduce the medical cost of a patient over time. We either early diagnose, but then we need to be able to learn how to treat. So if we diagnose, let's say, kidney disease, we want to be able to say, what's the next step? There's a lot of AI work right now also in kidney injury. Acute kidney injury is something that's very common, but it's underdiagnosed and it leads to a lot of healthcare costs. So Deep Minds and a few of the other companies working with the Veterans Affairs has started looking at this. For pregnancy, a simple tool to incorporate AI into women's healthcare and addressing maternal gaps is really important, where the patient is reporting their symptoms, the symptoms get aggregated into a way where you can say, this is not that interesting, or it's not as, there's no red flags, but this may be. Lack of movement or other things would be more important. So it can become smart, and the machine learning algorithm can start to figure out what are outcomes and how do you drive towards better outcomes. Another thing is A15 platform. I come from Anthem originally as my prior work, and it's a platform designed to enable physicians and newborns and parents to share their data across ecosystems. The more we can share, the more I get excited, because I think some of this information, if you have multiple capabilities from different companies, academic institutions, and researchers, you're then able to really dig out what is the real signal that you want to find. I'll also talk a bit about prior authorization. So in healthcare, what's a big mess of paperwork is in our industry, when and where do you let someone get a cancer therapy, an MRI, or when do they qualify for surgery? So a lot of AI work, even at Anthem, where I was prior, was looking at automating manual tasks. These are nurses. We have thousands of nurses that literally wait for the fax machine to come in, figure out how they comb through the medical records to figure out, oh, this person had this type of, as we mentioned earlier, knee injury plus physical therapy plus qualified for all these things, and they can check the boxes. There's two ways to do it. One is it just automatically checks the boxes, and then you can go back to where it was. There's also another way where we've seen AI doesn't get us all the way there, but halfway there. So if there are 5 boxes to check, it checked 4, that already saves the nurse a ton of time. The remaining 5th box they have to check, let's say that qualifies for they were on pain medication and didn't work, then they can just go back to the records and look at that. So you streamline at least the first 4 steps. This frees clinicians at both the payers and the providers to focus on complex cases, and then elevates them, which we talk about helping clinicians practice at top of license. This goes back to the surgery case, it goes back to the nurses at an Anthem, it goes back to an OBGYN doctor who's tracking a pregnancy where they don't have time to answer every call or every question of a scared mother, but they are able to at least figure out some things that are more important, and they can figure out what the red flags are. I will talk a bit about customization and access as the remaining last few moments, as we're thinking about health disparities. So one thing that we struggle with, especially in AI in healthcare, is that whatever you have the data come in, you have to make sure that the data is correct. So meaning if the last 10 years I prior auth and allowed people of certain races, ethnicities, backgrounds to get 80% more coverage and approvals of the MRI or the surgery, then that algorithm is just going to use that pattern to generate the same type of approval. And so you can create biases. So what we've done too is instead of using at former approvals, we actually then went back and said, okay, let's compare formal approvals with existing nurses and what they would do. So we tried that, and we tried to figure out at what percentage are we allowed to say this was 99% accurate, maybe 1% discrepancy. So the algorithm churned out and said most of people should get approved and these shouldn't. And so for that 1%, what does that mean? Is it enough? Is 5% enough? Is 0.1% better? So we've had to really try to figure out where the threshold is for when you compare real manual labor with what the AI algorithm can do. So affordability and access is something that I think AI can help fight against, where I'm really excited about that. But we have to think through the medical research, and just like drug discovery and other things, how are we thinking about the population? And last but not least, accessibility and affordability. I'll give a quick example at the end just about what I do at Everly. So we want to use AI to support traditionally poorly served populations to create better health outcomes. A good example is this. So Everly Health is a home diagnostic company. We work with various patients, payers. So we have a consumer-driven brand that does food allergies and sensitivities, but we also work with payers, an Anthem, a United, to help them close their care gaps, what we talked about earlier, which is colon screens and also A1Cs, diabetes screens. So it's a home test. You prick your finger and you drop some blood. What we have seen, though, is when people come in to fill out this profile, they'll say something like, I want to know my fertility journey. I want to know if I am fertile, where I am. And they take a bunch of hormone tests. But then what they fill out is actually they sometimes have some hair loss. They have a little bit of weight gain they're not sure about. Our AI has been able to tell us, actually, they should probably get a thyroid test. Because when they're looking at this, thyroid actually affects infertility, and it actually can lead to worsening health outcomes. So being able to say, these are things that you should be looking out for, in addition to getting a fertility test, is what we're excited about. So this creates a more customized, personalized journey, and then ultimately, if you can gear that more towards test to treat, so diagnostic-driven care, and the algorithm can help create a patient journey that's very seamless and exciting, I think that's where we're really trying to go. That's my talk for today. I hope that was helpful. This was more of an overall healthcare journey discussion, and I can take any questions.